Hi everybody, I'm Dr. Salem Samra. I want to talk to you all today about a common problem that hand surgeons see. It's called trigger finger. To discuss the problem, I have brought a model and I've also sketched a diagram as to what's happening in the trigger finger patient. Come take a look. So, trigger finger is a problem that affects the flexor tendons of the fingers. The flexor tendons are cords that connect bones to muscle. The fingers flex when muscles in the forearm contract and they pull through these cords that pull on the bone that bring the fingers in flexion. In a trigger finger situation, a patient can flex, but as they extend, their finger gets locked. It clicks as they try to open. This can be an annoyance at first, but it can become painful. What's happening here? Well, if you take a look at the picture I drew, the flexor tendons run back and forth in these fixed tunnels. The tunnel is called the flexor tendon sheath, and the sheath is made up of pulleys. The cruciate pulley and annular pulley just describe how the pulleys can be cross-shaped or ring-shaped. Those pulleys fasten the tendon to the bone and give the tendon force as it's pulling on that bone and flexing the finger. Now, in the trigger finger patient, what's happening is some inflammation and swelling is occurring in the tendon. It's forming a nodule. And the finger flexes, the tendon moves towards the wrist, but then as the patient wants to extend, that nodule is getting caught on one of the annular pulleys. The flexor tendon is not able to get back into its tunnel so that the patient can extend. Again, this can be painful, and it's a positive feedback process where the impedance, the friction causes more inflammation in the tendon, more swelling, and the problem can get worse. So there's two treatments for this problem. The initial treatment for most people is to have a steroid injection. Just like you can have a steroid injection in your back or in your hip, you can have a steroid injection to your hand. That'll cause an anti-inflammatory reaction at the place of swelling. That'll get the tendon to shrink, and now the tendon can glide again. Steroid injection can be done in the office, and it's usually very efficacious and can give patients relief. If after steroid injection, patient is still having a problem, or if after they get better, the problem comes back and they want a more definitive solution, with a small surgery, we can divide the A1 annular pulley. We can cut this band of connective tissue, and that liberates the tendon. That solves the triggering problem, and that clears the pain. So, a brief overview of the problem of trigger finger. It's a very common problem hand surgeons see, and one that we treat routinely here at Samra Plastic Surgery. Thank you.